So hello everyone. Welcome to this press conference. Just to mention to start with that this is being broadcast live on the Facebook page of the Minister of Health and Social Services, MSSS, as well as that of Santé Montréal. We will start this press conference by a speech in French from the National Director of Public Health, Dr. Horacio Arruda, followed in order by a speech in French from Ms. Chantal Rouleau, the Minister responsible for the metropolis and the Montreal region, as well as finally by Dr. Mylene Drouin, who is the Montreal Public Health Regional Director. They will then follow in the same order in English, and afterward we will have a question period in French, followed by a question period in English. And I add the presence in the room of the Regional Director of Public Health of Laval, Mr. Jean-Pierre Trépagny, as well as over the phone the presence of three Regional Directors of Public Health, that of the Laurentians, Mr. Rick Goyer, the Montérégie, Madame Julie Lellier, and Dr. Richard Lessard from the Lanaudière region. And if the journalists wish to ask questions to them, they are available to answer questions through the communication services. I now hand over the mic for a brief introductory word to the Mayor of Montreal, Ms. Valérie Plante. Thank you. Hello to you all. And of course, I wish to salute the Minister responsible for the metropolis, Ms. Rouleau, Madame Drouin, Dr. Drouin, with whom I have been collaborating on a daily basis, and Dr. Arruda. It's a pleasure to welcome you here in Montreal. I also wish to salute my colleague from the borough, Christine Black, the mayor, as well as Madame Robitaille, member of parliament from the riding here in Montreal Nord. What I wish to say, of course, is that yes, Montreal and the metropolitan area, we are the epicenter of this pandemic. And despite everything, I wish to mention to what extent Montrealers and the entire metropolitan area population and public have shown resilience, discipline, and solidarity. These are not easy moments that we're going through, but we do have the capacity to get through them. We've shown over the past 8 weeks that we really can hold together. I also wanted to mention to Dr. Arruda to what extent the City of Montreal is a partner for the health network and public health. I am very proud of the work that has been done and that we've done together over the past few weeks to find quick answers to problems and emerging issues. I'm thinking, amongst others, the question of the homeless population, and we will have the pleasure to go to a day center at Canada Place later to show the facilities that have been deployed. I'm also thinking about the measures that were set up to support low-income housing and for, the broadcasting of hygiene measures, and also the buses, the mobile buses and shuttles that we inaugurated with Dr. Drouin earlier on this week. So, upon these words, we're very happy to be able to welcome you here. It is an honor to be able to hear live. It is a case of saying what the situation is in Montreal. And please note that the City of Montreal and all of its partners, we are there. Thank you. Inaudible? Ladies and gentlemen, hello. I am happy to be in the metropolitan area, being myself born. I was born not very far, and I do live in the 450 area. But I wanted to be here amongst you today because, as we've mentioned many times, the portrait and the evolution of COVID-19 is different from one region to another. Outside of the Greater Montreal area, the situation is being considered as being under control, but in many sectors of the metropolitan Montreal area, which includes the island of Montreal, the island of Laval, and a part of the Montérégie and the Laurentians and Lanaudière regions, the situation is more problematic. And I do salute the presence over the phone of my colleagues and public health directors of the Greater Montreal region. Our response to the situation is done in a concerted way. I think that this has to be understood, that the work that we do in public health is concerted, and concerted within Quebec, also concerted within Canada, and up to the World Health Organization. We wish to give ourselves the means to add efficiently to screen the greatest number of possible cases. And that is why today we are launching a screening strategy that is massive in targeted regions. This is an approach that will allow us to better measure the community transmission, to better protect the population by having a more specific diagnosis of the situation where there's more. It is important to mention, as I have often said, that the first step of this approach is based on the collaboration of the public. We can advise. We can give orientations. The response of Quebecers, of Montrealers, of people from the community in the metropolis has been excellent. But it is important, and I'm going to repeat it often, if we wish to be able to get to a deconfinement without having problems that will bring us back, it will be important to keep having your collaboration. The main message today is that if you have any symptoms, call 1-877-644-4545. If we're talking about symptoms that are compatible with COVID-19, it's fever, the appearance or of cough or it becoming more serious, difficulties breathing, a sudden loss of smell without congestion that can come together with a loss of taste. So these are symptoms that can allow you to recognize that you have symptoms that are possibly compatible with COVID-19. If you have any of these symptoms, we ask you to please call the Info Coronavirus line. The staff that will be taking your call is very well informed right now of what the guidelines are and will be able to orient you towards the correct resources later. They will be having specific information concerning your sector to know where you should go for those screening tests. It is clear that the portrait within the municipalities, the different cities, can vary from one region to another or from one sector to another, and that is why it might be not buses, but a designated screening clinic or a designated evaluation clinic. But as I told you, as I said earlier on, the people at the Info Coronavirus phone line will be able to direct you to the correct place. Here in Montreal, there will be mobile units. Basically, it's a bus that was inaugurated very recently. It will be easily accessible, and it will move around, particularly in those sectors where we have more active transmission. The Regional Director for Public Health, Dr. Mylene Drouin, will be able to give you a few more specific details very shortly. We are therefore adapting these screening methods as the situation evolves. And I find that really important because people often say, you said this yesterday and now you're saying something else. We are in a situation that is constantly evolving. We don't know what tomorrow will be made of. This virus is very new. We don't have all the knowledge that we'd like to have to be sure of the things that we're doing, and we must adapt ourselves on a daily basis to this new evolution. We have mentioned during the announcement of the new diagnosis plan of COVID-19 in Quebec, that was last week, that the regions where we observe community transmission that is sustained will receive a total of 80% of the available analyses. And that's normal. We are adapting the screening offer depending on the epidemiology to allow to detect as many cases as possible and not use tests for benefits that would not really be true benefits. Right now, it's about 10,000 tests per day that are conducted, and we target to very quickly reach our objective of 14,000 daily tests. I don't have the data for yesterday's tests yet. The compilation has to be made, but with the efforts that we are deploying for this new screening approach, we do believe that we'll be able to conduct 14,000 tests in the upcoming days. This means a total of 100,000 tests that will be conducted per week in Quebec. I would like to also say that certain people who are considered as being COVID positive are considered COVID positive without having a test. If you were in contact with somebody who was confirmed as being COVID positive and you show the compatible symptoms, we consider you as being COVID positive. We call it by epidemiological link, taking into account the specific symptoms, particularly if you have certain signs, then you become a case of COVID positive. We don't need to use a test on you. It's been done in Quebec for a while now. The massive screening that we are doing is part of one of the conditions that we mentioned, and it is very important in a context of deconfinement because that started in Quebec. In all regions, but particularly in areas such as these, the measures that we remind you of every day and that we've been reminding you of every day now for almost 2 months, that they be respected. Those being physical distancing, respiratory hygiene, and as such, the mask, the face covering, now is part of that respiratory etiquette. Without it being mandatory, it is very strongly encouraged, particularly when you have gatherings or where you think that you may not be able to maintain the 2-meter distance, for example, in public transportation, etc. So I think that it is important that people be able to use it as part of respiratory etiquette rather than coughing in your elbows. The secretions will be kept in the mask. But I repeat it, and I repeat it, and I repeat it. You must wash your hands. That remains the most important thing. I wish to say that deconfinement does not mean release. It seems that Mother Nature has sent us a weekend with snow to remind us that it's not because we are easing things a little that we have to go back exactly to what we were at before. I know that it is difficult. I know that being stuck inside is excessively difficult. But if people do not apply the measures that we are setting up, we are going to put in peril the fragility of the deconfinement that is being conducted right now in certain regions. So we are opening things up progressively. We measure the effects. We make sure that we can control the possible outbreaks, but it's really impossible that the rest of the population follows. It's not time to have gatherings at home, to have people over, because we will be increasing the probability of having cases, we'll increase the probability of having an overloaded health system, and we will lose everything that our previous efforts let us acquire. I want to think of a last element that is very important, and I speak to you now as if you were patients, as public health often speaks to people. We're hearing from the field that many people who are cases or contacts of cases are contacted by public health authorities who investigate each of the cases to have a case history, but that people don't necessarily do the follow-up that is required of them, either that they don't check their symptoms, they don't remain isolated, etc. You will understand that this situation is very problematic and will greatly harm the work of our public health teams who are working night and day to try to limit the spread of COVID-19. The success of the different measures is based on everyone's collaboration. We've had collaboration up until now, and we can't stop with it. Please, for me, it is very important because if we let ourselves go, we will lose and we will have to come back, and that's not what we want to do. So, it is primordial to follow up with what we tell you. If you are a contact or you have to isolate yourself and you have to answer the questions of public health teams that work with us. It's very important to protect you, to protect others, your family, the most vulnerable people in this society, and it is in this way together that we'll be able to get there. I thank you, and I'll be happy to answer your questions and now hand over the mic to Madam Minister. Thank you, Dr. Arruda. Inaudible. I also thank the Mayor Valérie Plante and the Mayor of Montreal Nord, Madame Black, as well as the members of Parliament who are members of the National Assembly who are here. I want to insist on the role of each and every one of us in order to limit the spread of the virus in our communities. The Premier announced yesterday that the reopening of businesses and schools and daycare centers was going to be postponed to the 25th of May. This is a decision that we thought about a lot and which is very prudent. The health and safety of the population are our priorities. And you see it every day. The battle that is being waged in the Montreal region has not yet been won. We are stepping up the screening and communication efforts. But we can't let down our guard. Prudence is still important. And I want to reassure you on the true teamwork that is done, where we all have an essential role to play. I wish to salute all the collaborative work that is being conducted between the different instances and administrations, whether they be municipal, provincial, and public health. It is important for the population to listen to the guidelines of the public health authorities. And despite all the deconfinement that is being started in Quebec, it is essential to respect the different measures that have been set up, especially having to do with social distancing. That is, for example, when you go to external spaces like the parks that we have in the Greater Montreal region. And with the spring, some of the beautiful days that are coming, of course, it is quite normal to wish to go outside, to breathe in some fresh air, to walk and to move. It's normal and necessary. It is a question of physical health, moral health, and mental health. However, at all times, a minimum distance of 2 meters must be maintained between people. I see, just as you do, that more and more we see people in the metropolis who are wearing face coverings. It has been shown that certain people can be contagious without knowing. The wearing of a face covering is therefore recommended in public places when physical distancing is not possible. That can take place, for example, in grocery stores or when you take public transportation. The CNNSST, the Commission of Norms, Equity, Safety and Health at Work, has produced a toolkit for public transportation to make sure that people can move about safely. The wearing of face coverings is strongly recommended. I wish to thank the employees of the different transportation groups who have done essential work up until now to allow our workers, particularly in the health sector, to be able to get to work everywhere in Quebec. But as was mentioned many times, the wearing of face coverings in public spaces must mandatorily go together with the other protective measures, whether it be in public transportation or elsewhere. And those measures are, of course, the hygiene and physical distancing measures. You must wash your hands, and you must keep a distance of 2 meters with other people. I would like to thank the precious collaboration, in fact, your precious collaboration of the past weeks. Thank you to all the citizens of the Montreal area for your patience and for your efforts. Solidarity, resilience, and generosity are truly there during this period of crisis. I would like to mention the exceptional work done by the staff, whose daily work is to be with the elderly who are often isolated in their residences. That solitude is hard, but the staff smoothly helps them get through. For people who are reaching the end of their lives, the absence of their loved ones can be very painful, and it can transform itself into a comforting presence until the last breath, thanks very often to iPads or phones that are held by our employees. Those moments filled with emotions give a little bit of humanity and to this entire period of distress. And allow me a word to all mothers, those who are going to become mothers, the mothers of all generations who are at home, and those who live in residences for the elderly. I know how much these moments of isolation are very demanding. We are thinking of you, and thanks to your love and your generosity that is without limit, we'll get through it. Please allow me for this Mother's Day to say, I love you, Mother. More than ever, we must hold together, and I'm convinced that we are going to continue walking together towards a full deconfinement and the recovery of our metropolis. Let us be prudent and let us respect the rules. I thank you. I am very proud to be a Montrealer and to be a Quebecer. Thank you.
Dr. Drouin.
Dr. Drouin now. Thank you, Madame Rouleau. Hello, Dr. Arruda, Horacio, Madame Plante, and Madame Rouleau, and thank you for being in Montreal here today. I think it's a very strong message for the Montreal population to have messages as well that bring us to get through the next few weeks that are coming up, because we are perhaps different from the rest of Quebec in this pandemic and even from the rest of Canada, and we still have to come together for a while yet. And I think that your presence makes quite a difference today to remind us that we have to really come together and respect the public health guidelines. Last week, I announced, and today we are in Montreal Nord, we announced targeted screening in certain areas because of the important increase in the number of cases where we suspected that there was community transmission that is sustained and that we couldn't qualify it easily. I wish to thank all of our partners, the boards, the community, the CIUS Nord, who mobilized very quickly to be able to set up an adapted strategy in order to be able to test, but also to be able to come in contact with the population of different neighborhoods, Montreal Nord, but others as well, for the next phase, which is that of making sure that people apply the recommendations of public health, but that they get screened as well. And with that, knowing that community transmission is pretty sustained in Montreal in many different neighborhoods, we announced as of this week a regional strategy to intensify screening all over Montreal, and I think that my colleagues from other regions of Montreal are doing the same. This strategy is going to basically add many thousands of tests throughout the island of Montreal and has designated, so we use the designated screening tests with an appointment or as walk-ins through the 1-877 number, and we're going to be putting the information on the website. But to that, we're adding, thanks to a partnership with the STM and the City of Montreal, we're adding the mobile units. So that right now we have 2 circulating over different territories in Montreal. And the objective of those mobile units is to truly go to hotspots where we can see more sustained transmission. So we look at the number of cases and the rates of the past 14 days, but also in neighborhoods where we know that there are barriers, be they of language or transportation, to access to the screening facilities. So for me, it's very important to be able to have these interventions. These will come together with conscious awareness raising in the community and activities around the guidelines, but also to try to understand the needs of the populations. Because we know that confinement also has collateral effects and exacerbates social inequalities, and other needs have to be met. And the more we delay the reopening of sectors, economically, socially, and more these collateral impacts are going to be even more difficult, and we have to keep an eye on them. So screening is one thing. It's an essential condition to be able to reopen certain sectors of the society safely and with success. So we don't want to have to go back. Following the screening, as Dr. Arruda said, very quickly, we must, another key to that success of a successful deconfinement is to be able to investigate within 24 hours for all the cases, and of course to be able to trace the contacts, isolate them, and if we see that there are living environments in which those cases were present, we must identify the outbreaks and intervene quickly, whether it be in a work environment, a daycare, a school, or a community environment. And that is the work of public health. And we can only do it with the collaboration of the public. I think that Dr. Arruda said it well. When public health calls you, the guidelines that are given to you of isolating yourself if you have symptoms, of isolating yourself after having had a test while you're waiting for your result. You should wear the mask and isolate yourself. Same thing if you're a case or a contact. I think that the messages were very well heard at the beginning of the pandemic with the wave of travelers. And after that, the focus went more on CHSLDs, and that's quite normal. But those guidelines remain important and will remain so for many months to come. So today, Montreal has 18,435 cases and over 1,727 deaths. We really are the epicenter of the pandemic in Canada, and we must double our efforts. As I was saying, the first wave were the travelers. We very quickly set up great screening strategies, populational ones. We investigated all the cases. We had operations at the airport so that the guidelines to travelers be well understood on the need to isolate themselves. And I think that we collectively succeeded in flattening the curve. Afterward, the virus entered our CHSLDs and residences for the elderly, where are our most vulnerable. And I think that we are still working and fighting against these great outbreaks. But now what we can see is that we also have community transmissions in certain neighborhoods. And we have to go back to what we did in what we've done already in May, which is very intensely testing people and intervening, because I think that just like in March, we can re-flatten the curve in the Greater Montreal area. I understand that we are experiencing a lot of uncertainty, and we wonder why Montreal, why is the Greater Montreal area so different from the rest of Quebec? Yes, we all have specificities that makes it that it's more difficult to wage such a war and to fight against a pandemic. I am conscious that we are all tired. We all look forward to seeing our families and friends again. It's Mother's Day over the weekend. I also would like to be able to go with my parents. But physical distancing is even more important in our region if we want to get through this as quickly as possible. Deconfinement and spring, so the reopening of certain activity sectors and spring are going to make it that there will be more people who will walk around in Montreal. We love spring in Montreal, and that means that we have to be even more careful and take our precautions to protect ourselves, but those who are most fragile, because they are the ones that we don't want to see fall ill, because of course there are risks of much more serious complications, and they also have the right to enjoy spring. So we would ask you for the 2-meter distance, avoid gatherings, internal or external. We have to continue, and of course wash your hands, respiratory etiquette, and wear a face covering in public spaces. But face coverings do not replace distancing. It is very important. So this is an effort that we have to all bring about collectively. We have to keep to solidarity with this, because I think that in Montreal, in the Greater Montreal area, we can get through this next stage. English now?
I'm going to do my speech in English, but before I would like to say thanks to people. I will say it in French and then coming back to English.
I would like to truly thank the entire Quebec population for its collaboration. We've thanked a lot of different health workers, our garden angels. We've given them all sorts of names. I would like to thank, if you will allow me, our army of health workers, people who do the investigations, who are very often invisible, with the teams with whom I work, the public health directors, the different investigators who do work in order to avoid a lot of things. I wish to thank them from the bottom of my heart. I am so proud to be at the head of the Quebec Health Network with people who are very competent and who right now are working night and day and have been since January to try to control this epidemic. Everyone's work is important. I ask you to collaborate with them because their operational success depends on you. So to my great public health family, I wish to thank you from the very bottom of my heart.
We wanted to be here today because, as we often said and stated, the evolution of profile of COVID-19 is very different between regions. Outside Greater Montreal, the situation is considered to be under control. Let me also thank my colleagues at the public health directors that are not in that cell. They're coming from the Greater Montreal area. And they are not here in person, but at the phone. So because our actions are taken in concert on the island of Montreal, Laval, and I would say some parts of Montérégie, Laurentides, Lanaudière. This is why we are today initiating a strategy of massive screening in the targeted regions. It's an approach that will enable us to better measure community transmission and protect the population. The first step in this process relies on the cooperation by the population. You are part of the equation. Without you, without your commitment, without your respect to what we are telling you, the situation will go worse. So it's why you are very important. Today, main takeaway message is this. If you have any of the following symptoms, call 1-877-644-4545. The symptoms that are compatible with COVID-19 are as follows: fever, onset or recent aggravation of coughing, respiratory difficulties, and the sudden loss of smell without nasal congestion or loss of taste, among others. If you have any symptoms of this COVID-19, call the Coronavirus Information Line. You will speak to staff who are aware, well informed, and they will refer you to the right place to do the screening and take the good actions. We are currently providing around 10,000 tests each day, and we want to go in the next days to reach the target of 14,000 tests on a daily basis. This means that soon we will do 100,000 tests that will be performed each week. This massive screening effort is very important to the context of lifting lockdowns, which has already begun. In every region, the strategy could be different. The settings could be different. It is very vital to maintain the measures dealing with physical distancing and respiratory hygiene that we have repeated every day for almost a month. It's not because we are, I would say, lifting the lockdown that you mean that you can ignore those measures. Physical distancing and hygiene, using masks when you go outside is very important in this situation. Just before handing over the microphone, I would like to tell you something as a final matter. We have heard that many people who have the disease or are in contact with people who have it have been contacted by the regional public health board, but they are not following the recommendations made by the public health people, like isolation or making surveillance of their symptoms and everything. Please understand that that creates problems and is really affect our capacity to do the work we've performed too, which is prevent cases. The success of the measures we take relies on everyone's cooperation. So let me reiterate that it is of prime importance to follow up on what is requested, and you continue to monitor yourself as needed. This is extremely important because it will help to protect yourself, your family circle, and your neighborhoods. This is why the measures have been taken. Thank you. And I want to thank, I would say, my underground army of public health and the ones who came helping public health to do their job to try to really control and lower the impact of this terrible epidemic. But I think we can count on every Quebecois and all the staff to go through that process. It's a little bit more difficult. It's more difficult in Montreal because of the density of population, and it's normal that in urban places we see that kind of thing, but together I think we can be better and we'll be stronger after the crisis. Thanks.
I would like to re-emphasize the role of each of us in limiting the spread of the virus in our communities. The Prime Minister announced yesterday that the reopening of business, schools, and daycare centers has been postponed until May 25th for the Montreal region. This is the right decision. Public health and safety is our priority. As you know, we see it every day. The battle is not won in the Greater Montreal region. We must not let our guard down. Caution is the word of the day. This is a team effort where we each have an essential role to play. The CNESST has also produced a toolkit for the public transit sector to make travel safe for everyone. Wearing a mask is highly recommended. More than ever, we must stick together. I am convinced that we are taking the right steps to head towards the deconfinement and towards the revival of our metropolis. Let's be very careful and follow the rules of public health. And finally, we have a thought for all the mothers for this weekend. Happy birthday for our mothers. Thank you.
Thank you. Thank you, Dr. Arruda, Madame Rouleau. I would like to add a few words on the screening strategy for Montreal. We've launched this strategy, this intensive testing strategy at the beginning of the week, where we want to screen a couple of thousands of people every day. We have centers for testing that are in different neighborhoods, but what we've added with the collaboration of STM and Ville de Montréal are mobile units that are going to go in different neighborhoods to where we know we have an increased number of cases of COVID-19 and sustained community transmission. Also, we're going in neighborhoods where we know that we have specific barriers to access to testing that can be language, certain cultural communities, or transportation. And I want to thank all the partners that are working with us and those unit mobiles, because when we're going in a specific neighborhoods, we're going to have outreach strategy and door-to-door activities or with community groups to make sure that we go and we reach the people that are more isolated. Montreal, of course, we are the epicenter of the pandemic, the region of Montreal, and I know I understand that all Montrealers are living a lot of uncertainty. We don't know when it's going to end, and of course, seeing that we're different from the rest of Quebec that are going to open schools and commerce and stores, we also want to end and have a return to a normal life. At this time, we know we're tired. We all want to have visit friends and families. But it is not time to relax on measures. We have to keep the 2-meter distanciation. That is really important. That is difficult in a context, so in an urban context, but it is really important. We have, of course, to maintain hand washing. And of course, in an urban context, we really want that the face cover be used in public space where it is difficult to maintain the 2-meter distance. And I think doing this is doing it for yourself, but at the same time, we have to do this for all the vulnerable groups, people that have to be more isolated, families that have children that are sick and that cannot go outside. They also must have the chance to enjoy spring that is coming. And if everyone's making this effort, I think we're going to go get out of this pandemic sooner. And I think that's what we all want. So thank you, and I think it's a solidarity action that we ask every Montrealers to do.
I will take a privilege I just want to say, je veux juste vous dire, Montréal.
I just want to say, Montreal and the region, we love you. It's not because we're in Quebec or it's not because elsewhere is going better that we don't love you. We are here to help you. And if I ask you something, it's really so that we can go back to a normal life as quickly as possible. I love you, everyone, all Quebecers. I am myself the son of immigrants, born in Quebec, but very proud to be here amongst you all. So I wanted to say that to you. Thank you very much. Dr. Arruda, Dr. Drouin, Madam Minister, thank you. We will now go to the question period, for which, unfortunately, we will not have very much time. We have asked the journalists who are present, since there are many of them, to limit themselves to one single question.
J'aimerais maintenant vous rappeler que pour poser une question, appuyez sur l'étoile suivi du 1 sur votre clavier téléphonique. Veuillez patienter un moment pendant que nous compilons les questions. Votre première question vient de la ligne de Annie-Sophie Poirier du Journal de Montréal. Votre ligne est ouverte. Oui, bonjour.
Yes, hello. The question is for Mr. Arruda. Marguerite Blais this week said that the caregivers were going to be help their loved ones in CHSLDs as of Monday. However, they had to show that they were negative in CHSLDs where there were no COVID cases. But in a phone interview this morning, she announced that the caregivers would not need to be screened. And I'm wondering why this changed. Well, it's true. And when that guideline was given, there had been discussions to know whether it was necessary or not. In the context where usually workers go into an establishment, and I would say without being tested, it seemed to us that to be equitable, last night there was a guideline following an internal discussion that we had at the ministry to allow for the access, taking into account the negative impacts. And we said it. The people who are alone, who are older, who are not stimulated, who perhaps won't eat as well with somebody else. We consider right now that the risk of introduction by a caregiver, if the measures are well applied, people don't go in the same way as before. They have to wear masks, etc. So we've changed things. I can tell you that we will be changing things as we go along regularly. As I was saying yesterday in a press conference, it's also when we talk with our patients, if you allow me, with the public, here, and we get feedback that we decide together what is better and to not just unilaterally decide. Thank you.
Votre prochaine question vient de la ligne de Sébastien Desrosiers de Radio-Canada. Votre ligne est ouverte.
Oui, bonjour. Ma question est également pour
My question is also for Dr. Arruda. Pretty simple question. In fact, you are in the metropolitan area today. And to go back to the words of Dr. Drouin, there is sustained community transmission in certain hotspots of Montreal. When do you believe that we'll be able to take control back of the epidemic on the island of Montreal? That's a very good question. And if I had the answer, I'd love telling you. But it will depend on how the public behaves and how, I don't want to put the onus on the public, but how we'll be able to have enough tests to have the correct diagnosis, the ability of public health to intervene very quickly with cases. That's all part of the conditions. So we're going to be keeping a very close eye on that on a daily basis, to not say on an hourly basis. And I believe, or at least I have good hopes, that with the mobilization being conducted and which is continuing in terms of inquiries, and I wish to mention that when I see the numbers come in for the metropolitan area in terms of number of cases, it's exceptional, the work that has been done up until now in terms of investigations and control. So we'll see. We'll see how the numbers evolve, I hope as quickly as possible, but that is why it's so important that people do not deconfine themselves completely, because that is where, with the quantity of the population of Montreal, if we end up with outbreaks around families, etc., then it's going to be difficult, and that's where we'll have cases appear that will be more serious and cases that could come and clog up our health system, which has not taken place thanks to the lockdown, the full stop that we brought the province to. And we can't slacken. This is it's a challenge, you know. Stopping everything is easy. Starting up again is hard.
Votre prochaine question vient de la ligne de Dan Spector, de Global News. Your line is open.
Hello, this is for maybe Dr.
English.
Drouin or Dr. Arruda. With this large increase in testing, do you have the capacity to have a large increase in contact tracing? Do you have the staff and the technology needed to do the contact tracing that is associated with this increase in testing?
As I am a very polite guy, I'm going to let Dr. Drouin answer, and she's the one who's it's her business too.
But I'm going to talk for Montreal. We've built a team of enquêteurs of more than a couple of hundreds of people that come every day from 8 in the morning to 10 in the evening. We have a capacity, a current capacity of 500 enquête every day, investigation every day, and of course we've are informatisé. We're changing to informatic call to reach more person. But by testing more, we have to increase our capacity in the next couple of weeks, and that's why we're recruiting at the current moment new person to investigate more cases. And just for a comparison, normally we do investigation for about 6,000 a year, and we've done more than 18,000 in 8 weeks.
Thanks.
Votre prochaine question vient de la ligne de Olivier Fauché.
Following question.
Le journal Métro. Votre ligne est ouverte.
Oui, bonjour, ma question pour monsieur.
Yes, hello, my question is for Dr. Arruda. I was wondering how easily, being able to apply social distancing is very different depending on regions. In Montreal Nord, with small apartments, numerous families, are there more specific guidelines that could be set up in those neighborhoods? Well, clearly, social distancing is not the same in densely populated neighborhoods. For example, in Montreal, compared to other territories, we could even say that cities, some cities have the population of Canada in one same city in other places in the world. So the basic principles will remain. If physical distancing is not possible, wearing a face covering outside, for example, within the same family, one really should increase everything that is called hygiene, like laving hands. That has to be excessively frequently. You have to be almost a maniac about this. I think that is one of the measures that can be set up, in my opinion. But what is very important as well is that as soon as somebody develops a symptom, consult quickly so we can offer the recommendations to the family so that it isn't transmitted from one family to another. But I think that the basic measure remains respiratory hygiene and hand washing. And I believe that this is what we can do. And then in certain situations where there are cases, we can see how we can expose the people in the same house less. If there is one case in one house, maybe having one person in a room or placing people around, it's a lot easier when you have a 3-floor house than when you are many in a small apartment. That is why it's so important, in my opinion, to collaborate with people from public health who will also be able to find alternatives to be able to help those people who would be in difficult situations. For the time being, we don't have other isolation sites, let's say, for a family that couldn't respect this. And moreover, knowing that now we also have asymptomatic people who can carry the virus. Of course, when you are facing a family where there is a case and there's really a very great level of difficulty mentioning or maintaining social distancing or isolation of the case, it is clearly probably that will recommend that certain of the contacts be tested to check, because there's a greater probability that those contacts, even though they have no symptoms, that they might be exposed to the virus. So that will be part of the recommendations that we'll be emitting during the investigation.
Encore une fois, si vous voulez poser une question, composez l'étoile suivie du 1 sur votre clavier téléphonique. Votre prochaine question vient de la ligne Jeanne Corriveau de Le Devoir. Votre ligne est ouverte.
Oui, bonjour, Dr. Drouin.
Yes, hello, Dr. Drouin, Dr. Arruda. I had a question concerning, I wanted to know the screening objectives for the island of Montreal on the one hand, and when you're talking about investigative capacity, Dr. Drouin, how many people are you thinking that it would be necessary in the case of recruitment that you are conducting if you want to maintain the investigative capacity and increase it in the future? In terms of screening capacity, as I was saying, there's already screening being done in Montreal right now, mainly centered around care centers, CHSLDs, RPAs, health workers. The new capacity that we're adding, I would say populationally in the short term, is a few thousands every day, and we are targeting with the mobile units and the screening centers, the fixed ones, close to 3,000 per day as quickly as possible. So that is the portion of the 14,000 of Dr. Arruda. So our strategy is aligned according to these numbers in the short term. But of course, it's quite a challenge to be able to screen these, or to be able to find these screening teams. And in terms of investigations, I was saying right now we are working with teams of investigators. So we have 4 large investigative teams over 2 work shifts, and we add teams so that can easily represent, since it's 7 days a week, it can easily represent 50 to 100 people more that we have to add over the next few weeks. And by computerizing certain elements of the process, it will help us balance out. But it has to be understood that the other part that I haven't talked to you about is the management of the outbreaks with the reopening, because our teams, we also have to have teams, of course, to manage outbreaks in living environments that have to be created as we reopen certain sectors, schools, daycares, etc. So very easily, a few hundreds of people will be recruited for all of those public health strategies over the next few weeks. For your question on the objectives of the screening, there's many. There's different groups. We're talking about, we're not necessarily talking about priorities, but we have different groups. And according to the regional portrait, the needs and the number of tests per categories, that can vary. For example, it will still be necessary to have tests to have diagnosis in healthcare settings, in CHSLDs, but it will also be very important to have investigations in the community, families, etc. It will be necessary to have tests in order to be able to control an outbreak if, for example, manufacturing plant could have cases. And we can also need to test people who are asymptomatic, who have contact cases where we could potentially identify outbreak. But that will go according to the epidemiological portrait and the evolution of our capacities as well. So it's different in Montreal than it will be in Montérégie, but each portrait is like a diagnosis that we apply. We decide to apply the best treatment and the best usage of the tests according to a regional portrait. That is all the time that we have. Thank you to everyone. Have a good day, everyone. Thank you, and happy Mother's Day to everyone. Well, to the women that are mothers.